Start off. Hello, everybody. It's a pleasure and honor to be here at the event today. My name is Jennifer Ketterly, and I'm a sports dietitian representing Performance 365, and I am also the Associate Director of Sports Performance at the Duke Sports Science Institute in Durham, North Carolina. Ashley, take it away.
Hey everyone, my name is Ashley Besecker, and I am also a registered dietitian nutritionist, and my specialty is in nutritional genomics, genetics and genomics. So I work with professional athletes, and I work directly for the athletes, so under the branding of functional performance nutrition, and I'm excited to be here.
Hi, I'm Dr. Carolyn Alexander. I'm a fertility specialist, OB/GYN in Los Angeles. I went to medical school at UCLA with Dr. Charlop, so it's an honor and a privilege to be here today for such an important topic. And I am part of Southern California Reproductive Center in Los Angeles, and we focus on hormones and egg freezing and fertility care for all patients. I have the questions, Jen. Do you want me to start, and Ashley? Okay. How is a woman athlete's nutritional needs different from a man's? Who wants to?
Go ahead, Jennifer.
Sure. Well, the biggest difference between a female athlete and a male athlete on the surface, when we think about athletes, the first and foremost, we want to think about fuel. And so the fuel needs are going to be different. And in sports nutrition and as a sports dietitian, we always want to take the customized and individualized approach, if at all possible, meaning that we can take the activity level and your body type and your goals from a body composition standpoint and performance standpoint and apply those to your energy needs. Because at the end of the day, energy is really, really what it's all about. And the difference between clearly a male body and a female body from an energy standpoint is going to be quite different. So that's the macro big concept right off the bat, is energy needs are very different. Ashley, do you have some things you'd like to add to that?
Yeah, I would also say hydration needs are different as well. A lot of the typical electrolyte replacement things out there are really built based on studies for men. And so I am a huge advocate for redoing some of these really big studies for women. And there's a lot of great dietitians and scientists out there that are starting to redo these with female cohorts, but both energy intake and hydration, obviously based on where you're playing too. Jennifer, your athlete's in a hot climate, and I'm in Seattle. My athlete's in a colder climate. So I would just say that both intake of energy and hydration can be different.
Yeah. And for the reproductive age women, the water can have BPA. So I tend to echo, especially if they're thinking about egg freezing, to drink water from non-BPA plastic, because that can come into the follicular fluid, which is around the egg. And we don't know what it does, but it's important to recognize that not all water is the same kind of water.
Can I add one other thing?
Yeah.
So we talked about sort of the big nutrients, energy and fluid, which are clearly quite different. The other thing we can't forget to mention are some of the micronutrient needs that are quite different from a male and female. So we start to think about calcium needs for a female athlete, iron needs for a female athlete, and right off the bat at the get-go, males and females have differing needs at baseline. And so then when we layer on the athletic component, we want to really make sure that female athlete has particularly some of those micronutrient areas covered and taken care of. Calcium, iron are two big ones, cornerstones for the female athlete.
That brings up an interesting thought, which is in the 3 months before anyone tries to get pregnant or thinks about trying, folic acid can prevent spina bifida in the early fetal development. And so having an adequate folic acid level and vitamin D is really important actually before getting pregnant. And so I tell people it's like preparing for the Olympics, which many of you guys have done and do. And so it's like preparing for pregnancy. You want to be as healthy as you possibly can be, optimize all your micronutrients to get the best quality egg. And I call it the golden egg to pop out at ovulation to make a healthy baby.
That's great. And, I think this is a great segue too, Carolyn, to what you do in terms of, we talk particularly in female athletics about not only performance, but also the health of the female athlete. And so while energy and micronutrient needs and fluids are certainly important on the performance end of the spectrum for a female athlete, so do, if deficiencies are occurring in those areas, those then also have a strong connection to the health and well-being, particularly as energy underpins the hormonal status of the female athlete, which I know you see a lot of.
Said previously, it opened my mind to the menstrual cycle. I don't know if you want to tell us your thoughts about how the hormones shift over the menstrual cycle in our month-to-month variability, and that has important ramifications when you're training and all those things. You want to talk about that?
You broke up a little bit there. Were you talking to Jen or?
No, Ashley.
Okay, I missed that part. Yes, so what I find in working with my female athletes, both right out of the gate, high school, college, and into the professional level, is a lot of women don't understand how their hormones and their menstrual cycles work. And they've just been told kind of this myth that, oh, if you're a female athlete, you just won't get a period. And so we really, as healthcare professionals, want to dispel that myth and know that if you're eating an adequate amount of nutrients and energy, that will keep your body fat stores actually high enough. It's not healthy to get the body fat too low for a female athlete. And so one of the first things that we go into with my work after we kind of get some of that general nutrition down is tracking their cycles and learning about the different phases. And even if they don't have an actual bleed, there's some symptoms that can go around that. And so let's track the bloating, let's track headaches, let's track cramping, let's track some of that stuff so we can get an idea of where their phases are at. And then we get to play to those phases. So what that means is a female menstrual cycle is actually a secret superpower that females have over men, because there are certain points in our cycle that we are actually stronger, or we have a little bit more endurance. And if we can nutritionally kind of play to those, and with training as well, maybe doing a little less intensive strength training during certain phases, or push a little bit harder during certain phases. Rest is really important during certain phases. If we can understand where those female athletes are at, we can actually give more iron during those certain weeks. We can actually, give more, or there's just different things that you can use to your advantage in those phases. But I think the first thing is, are you tracking your phases, and do you even know kind of where your body's at? So it's this getting in tune with your body, and then once you have that, using that to your advantage.
Yeah, I think of the menstrual cycle as a vital sign, because in general, we really want our young girls in puberty to get their period. It is it's a amazing phenomenon, because that means the hypothalamus and the pituitary and the ovaries are listening to each other. And so young women athletes who, let's say, don't get their period, which is okay, that can happen, it's important to not just give the birth control pill, because that later, when we stop the birth control pill, their system didn't recognize the proper mechanism to get their period to be regular. And so sometimes it seems like an easy fix to just give the birth control pill, but it's important to talk about the pros and cons, because some people need contraception, and that would be important too. I think also with the menstrual cycle, what's interesting is that when young women have polycystic ovary syndrome, which happens to about 15 to 20% of reproductive age women, they get their period very spaced out every 40 days, every 80 days. And so they're not really having a regular menstrual cycle. And that can cause high testosterone, which can make you very strong, which is a blessing. But it also can have long-term risks for other issues like diabetes, as well as cardiovascular risk, as well as fertility issues. And so it's good to at least get the hormones checked and get a checkup to understand what's the situation. And then I tell patients we tackle each one by one, and understanding your own body, and every person is so different, then we can understand how to optimize your hormones and your future fertility, as well as the uterus, which is a very strong muscle, and keeping it healthy to carry a pregnancy down the road whenever you're ready to do that.
I couldn't agree with you more, Carolyn, that, this idea of and Ashley too, I'm really glad you both brought up what I think are some real take-home points. And for me, my experience of working with thousands of female athletes over the past 20 plus years is that this idea of the menstrual cycle not only being coming from a place of strength for us as females, but also the fact that, if there's any take-home point that I think our athletes listening today can take home, is that it is no longer a badge of honor to not have your menstrual cycle as a female athlete, right? That is so important. And I think that idea is still pervasive in our female athlete culture. And we now know that all of the hormonal changes, often negative, that happen when we lose our menstrual cycle, we now know is often, unless there's a medical complication there like PCOS, underpinned by energy. And so adequate calorie balance is so important for the female athlete. And if that's the foundation. And if we have cracks in the energy balance of a female athlete, meaning that they're not eating enough calories and enough nutrients to not only sustain their performance, we now know that those deficits are also affecting all the other symptoms, and in particular, those hormones that regulate and maintain bone health and metabolism in your immune system, your cardiovascular system. So there are implications we now know that the female athlete has if we don't take care of that cycle. And so I think if there's anything I would love for everyone to take home today, it's that if your menstrual cycle isn't regular, let's have a conversation about it and look at your nutrition, look at your energy balance, and work with a really good sports medicine physician to rule out any medical concerns.
And another thing I would say to that, amazing, Jennifer, I love that, is that, so some of my background is in disordered eating, and I know that athletes, you guys have so much pressure on your physical bodies. Your job is on a stage in front of a lot of people. And so a lot of female athletes, live and kind of get affirmation from these numbers, whether it's a body fat number or a weight number. And really, it's going to vary across the spectrum of what sport you're playing and what position in that sport. Sometimes your body needs to be a certain optimal kind of size and strength, but we gotta get rid of this idea that the lower body fat, the better, and the more cut, the better. And there's a lot of body image stuff that can happen with that. And that will affect your hormones, not only in that moment, but later in life, like Carolyn was saying. And so a lot of times I'm working with athletes on making sure their body fat's high enough. And so eating enough calories, eating the fat, eating all of that stuff, that's good. And females need to have a higher body fat than men. Again, this idea that, you know, females are not small men. And we need to make sure that you guys have enough calories and also enough body fat. And so I would stress to not worry so much about the numbers. Leave that to people like Jen and Carolyn and I to kind of make sure we adjust your meal plan to kind of get it in that range. But it's, again, there's a lot that you can do when you are fueled adequately, your hormones are going well, and you have enough body fat.
That brings up an interesting thought. In terms of your eggs, you're born with your eggs. And so what we do in our teens and 20s has ramifications for when we're in our late 30s, or even some of my patients up to into their 50s, ready to start a family. And so our egg quality is influenced by our body mass index. And it is so amazing how athletes stay so fit, but it also, if our BMI goes too low, that can have ramifications for the egg quality too. And especially if you're thinking about egg freezing or considering it, or freezing embryos to use in the future, which is a fertilized egg, it's important to prep the month ahead with a lot of avocado, walnuts, salmon, all the good fats, because that gives good cholesterol, which is required to make estrogen. And estrogen is essential for proper egg development and for ovulation to occur. And so there's a lot of preparation with vitamins and talking about nutrition like you guys do, and in the time period prior to thinking about fertility or protecting your fertility for the future as well.
I love the message that I feel like is really coming through this discussion, which is that, and this may be for all athletes, but in particular for female athletes, that, you know, this idea of wellness and well-being coupled with performance is no longer, they're no longer two separate identities, right? And so to be a strong, healthy performer, we have to take care of the health end of the spectrum, which feeds the performance end of the spectrum. So wellness and well-being is now sewn into our performance conversation.
I have a question. Oh, Greg, you're on.
Yes, are you able to hear me?
Yes.
Oh, good. Well, thank you. I guess I've become sort of the court jester of the Women's Sports Forum. So thank you. Thank you all for bearing with me. I'm the comic relief in between the serious things that everybody else has been chatting about. I love what you're talking about. And, you know, I wanted to ask you, you guys touched upon the missing periods. And I'm curious, is there any long-term consequence when athletes miss periods? Will that affect them later in life?
It's possible. I mean, in some situations, estrogen, when it's low, that can affect bone development. Our bones start to develop when we hit puberty, but they peak with their bone mass at 26 years old. So in that early 20s, if you're not having enough calcium or vitamin D and not getting your period, it can have long-term ramifications for hitting your peak bone mass, as well as your vessels of your heart, your coronary vessels, can stiffen over time if our body hasn't had enough estrogen exposure. And so later, when you're in your 50s or 60s, it's important to get your checkup. But what we're learning is women and men, when we do our cardiac evaluation, it's not the same. It's actually more detailed to look at our carotid thickness in our carotids, as well as our coronary calcium scans. And that might be different than how men are evaluated as well for cardiac evaluation when we get older. And I'd love to hear what everyone else has to say about that question too.
I would also say that if you have athletes, or if you are an athlete that feels like is that Greg? That sound? Oh, no.
It might be my office had the sound come on. Oh,
there we go. So if you've been up to this point, and let's say you're listening and you're like, oh my gosh, I haven't had my period, I haven't been doing this, or you're a coach or a trainer that's like, I have an athlete that's this has been going on for years. Nutrition is so powerful, and it is not a quick fix, but we can undo a lot of things or optimize a lot of things that may have been happening for a really long time. So our bodies are extremely resilient, and they are built for survival. So I feel like, so don't get discouraged if you have an athlete, or if you are an athlete that you feel like you haven't been really taking care of yourself like we're speaking about now. There are ramifications. So it's like, it's never too late. Now's the time. It's with nutrition, it's all about consistency, and it's all about, doing it for long periods of time. So you're not, just like one salad's not going to make you healthy, one burger's not going to ruin anything. It's, can you optimize your nutrition over months and years? And that means just balance and diversity of foods and eating enough over longer periods of time, because a lot of that potential damage that we're talking about that could have been done, whether it's your hormones, your menstrual cycle, depletion of micronutrients, that can be fixed with nutrition. And that's why nutrition is so powerful. And I'm sure Jennifer can attest to this as well. I've seen incredible changes over just a few weeks, but also year to year when I'm looking at labs. It is jaw-dropping what nutrition can do to kind of bring somebody in from maybe non-optimal into optimal, or standard into really optimal. So be encouraged. There's a lot you can do.
And Jennifer, what are your thoughts about this, about nutrition and lost periods, and either recovering from that or preventing that in the first place?
Yeah, I think we've talked a little bit about that, but I'm really glad that Carolyn brought up the bone implication. And I think, again, a big takeaway is that, if you're a female athlete and the menstrual cycle is irregular or missing, know that there is a very strong connection with your bone health. And that bone health, as Carolyn mentioned, is developing early on. And so if we don't address these early on, there can be long-term implications on bone density. And so depending on the time, the age, the potential deficiencies that do exist, we don't have all the time in the world to fix that, right? And so I think the take home is that there is a very strong connection with bone. And if we don't address that from an energy and nutrient standpoint, which then affects the hormones that protect the bones, down the line, we do face, as an older female, we can face things like osteopenia, osteoporosis. If we're still active and competing, stress fracture, and the inability to recover from those types of injuries, or having to extend that recovery timeline, is a real thing, right? And so I think the takeaway is knowing that there is that really strong connection. And then, as Ashley said, much of this, assuming that there's not a health concern present or chronic disease play, we can do a lot with nutrition. It underpins a lot of these issues. And so knowing that you can address it, you can fix it, it's important to fix it. And as a female athlete, we have to be concerned about that well-being as well as our performance.
Now, Jennifer, a lot of the athletes, I hear from a lot of women athletes, they're vegetarian or vegan. Shifting gears a little bit, what advice would you give to a vegan or vegetarian athlete? Is it possible to be vegan or vegetarian, or will that ruin your sports performance? And if so, are there any special precautions that they should take?
Sure, I think that's a great question and a really relevant one in today's culture. I have to say that I have seen a lot more athletes, male and female, gravitating towards a plant-based lifestyle, if not vegan. And I would say the easy answer to that is yes, we can absolutely be a high-functioning, competitive female athlete and follow a plant-based or vegan, vegetarian lifestyle. Now, the caveat is that we have to do this intentionally, right? And so this is where sitting down with a nice conversation around your goals, your beliefs, and around what you want to accomplish with the diet, and having that conversation with a registered dietitian can help just pay dividends down the line. But there are some nutrients, certainly, the calcium, dietary iron, zinc, some fats, all need to be intentionally planned into that lifestyle. You know, protein is another topic of conversation that maybe we can touch on here in a few minutes.
Ashley, how about you? Any recommendations you give to vegan or vegetarian or plant-based athletes?
Yeah, I love pushing a predominantly plant-based diet, right? Well, you eat like so many fruits and vegetables, and then you throw in your proteins and all of that. So I love that athletes are in general thinking more about plants and eating more plants. I love that. From a nutrigenomics perspective, so that's kind of where I can look at genetic variants and kind of how those affect various pathways. I feel that in my work, there are people that are going to be able to do well on a vegan or vegetarian diet, depending on those various pathways and how they absorb and transport and translate various nutrients. And there are people that potentially aren't really set up to do that as well. So like Jennifer was saying, if you're going to go the vegetarian or vegan route, you need to be very intentional about it and you need to understand protein complementation, making sure that you can get all of those baseline amino acids and not really depend on a bunch of the processed type foods and powders. And you can do it with whole foods, but you have to be very intentional. And then I would say also following blood work is very, very important. If you can make sure that you can get those nutrients in, because again, athletes are going to blow through their nutrition so much quicker than some of us normal people. And so they're utilizing it faster. And so we need to make sure that they're A, getting enough energy, but B, also getting those nutrients and those vitamins. And that can be as simple as, like Jennifer was saying, the micronutrients, rotating your nuts. And so you're getting a bunch of different fatty acids from different nuts, or your cooking oils, or your protein sources, different various beans and legumes. So I think I don't love the whole, well, I'm going to try going vegan or I'm going to try going vegetarian, because there are certain foods and nutrients that are more bioavailable as an animal source. So potentially it's keeping in fish once a week, or just lowering the meat consumption but leaving in things like eggs or cheese or something like that. So there's various forms that and ways that you can be more plant-based, but like Jennifer was saying, to just try it on a whim is something I don't support.
Now, Dr. Alexander, I'm curious, if you have a woman who's vegan or vegetarian and they come to you and they want to get pregnant, or maybe they're struggling to get pregnant, do you encourage them to change? Or
I try to tune in to their needs and check. We check with zinc is one of the biggest things that they'll be missing, as well as all the amino acids, because that's typically obtained from meat or chicken. But typically, in early embryo development, I noticed the placenta. It is so sensitive in that early few months that I try to encourage vegan women to, if they're open to eating eggs, because the egg yolk has the most choline, but so does cauliflower. So if they do eat a lot of cauliflower, I can kind of compensate for missing out on the egg yolk sometimes. And I noticed in early pregnancy, we'll have some vegan or vegetarian patients who say, like, I have this insane craving and I can't break it, and I want meat or chicken. And I'm like, you have to listen to your body, because your body is giving you a clue. And so it's a lot about understanding the person's hopes and as well as the early embryo developmental needs for their own pregnancy. And so every person's a little bit different, exactly like Ashley said, because I see that in when I talk to people.
Now, I want to switch gears again. Jennifer, you had mentioned protein, and protein comes up a lot. It's a big topic of conversation. We've got about 5 minutes left, and I wanted to cover a few more things, but I'd like to get your impression on how much protein do you recommend women athletes eat, both during their competitive years, and also does that change as they get older? How much protein should, say, a postmenopausal woman eat afterwards? What are your recommendations for that?
Sure. Well, that's a great question, and I think what I would say is that protein is, as we've begun to learn, is the quality of protein and the quantity of protein both matter. And a little bit to piggyback on our conversation about plant-based approaches. When we think about protein and following a primarily plant-based approach to eating, we have to recognize that those proteins, from a muscle building standpoint, are not, in recovery standpoint, are not on the same plane or on the same par as an animal-based protein. And that's simply because the amino acid profiles of plant-based proteins and animal-based proteins are very different. And we now know that the amino acid leucine, which is a branched chain amino acid that particularly in animal sources is the trigger for muscle building and recovery. And so not to say that it's not present in plant-based protein sources, because it is, but we just have to eat more of and eat differently when we're on that plant-based approach. So I think that, again, thinking about what's our style, what's our approach, as a person and as an athlete, what are our goals? And as we age, protein continues to be important as a competitive athlete, from a muscle building standpoint, from a recovery standpoint. But those same concepts carry on after we transition into regular life, like us, and maintaining that muscle, we now know, is both, again, muscle quality and muscle quantity plays a big role in our long-term health, not only on our bone health, but also our overall function. And so protein needs don't go down as we stop competing. They actually can go up in our later decades.
And Ashley, I'd like to get your take on this as well. Imagine you had 3 different women, let's say a collegiate athlete who comes to you, let's say a competitive 25-year-old athlete who's coming to you, and maybe a 60-year-old retired athlete coming to you. What protein recommendations would you give to those, say, 3 different women?
Well, try to individualize it as much as possible. So typically we calculate as much as we can. So one of the first ways that we have done personalized nutrition is through calculation. So we can do that for energy needs overall, and then again for the macronutrients, carbohydrates, fat, protein. So that's typically based on body weight. But then we can go even further. We can go into what their body is telling them, like Carolyn said, what you're craving. And then also it can change for injury. So when we're going into an injury state or potentially a prehab or a rehab around surgeries, those protein needs go up. So then it fluctuates, just like the menstrual cycle. Sometimes the protein needs shift during those phases. So, I've calculated out various numbers for women. So a lot of it depends on size and then weight and things like that. So, I have athletes that are trying to hit, 45, 55 grams of protein a day. And I have athletes that are trying to hit 90 grams of protein a day. So it's very different. And you can get those again, like Jen was saying, through so many different sources, but you will find that in order to hit, let's say 10 grams of protein, you can do that close with 1 egg, or you can do it through a big, huge pile of something like vegetables. The volume is much different. So I think athletes also need to think about the volume of food that it's going to require. You need more calories in general. So then the volume of food that it's going to require, how can you pack as much nutrition into a smaller volume as possible, especially when you're going to jump on the court. You know, sometimes you don't want a bunch of stuff in your stomach. So it's just, it varies athlete to athlete. And so a lot of that we can help calculate out for you, and then also apply onto kind of where you're at in your body and your phase of life and all of that.
All right, good. And we have about a minute left. I just want to go to each of you, and I'd like to give you to give each of you to give, number one, your favorite supplement recommendation, and maybe if you have a surprise supplement recommendation that maybe people don't talk about enough, but you'd recommend women athletes use. So let's go around. I'd like to learn your favorite and maybe a surprise supplement recommendation for women athletes. Jennifer.
Sure. I would say that probably my hard to say whether this is a favorite or a surprise, but I think the omega-3 fatty acid supplementation has a lot of use in the body, both from a health and wellness standpoint, but also from a performance standpoint. And so Carolyn touched on it, so did Ashley, the idea of good quality fats. We know that through large cohorts of athletes, we don't tend to, male or female, get enough of the omega-3 fatty acids in our diet. So that's one that I often really look at. You know, another one would be probably protein, to be honest. You know, particularly a lot of female athletes struggle to get adequate protein. And as Ashley said, we like to visualize that. And when we calculate that out, it often is quite a bit more than what female athletes tend to think they need. And so a protein supplement, good quality protein supplement that's third-party tested is often, you know, I'm all for it. If we can't do it through foods.
And Ashley, your two favorite supplements, at least one a surprise?
100% omega-3 fatty acids. Has to be an NSS certified for sport products, so be careful. Don't just go to GNC and take something over the counter, or make sure it's a certified sport product. And taking enough of it, I like to, you know, aim for at least 1,000 milligrams or 1 gram of EPA and DHA on the back of the bottle. Add those up and see if you can hit that. You can also eat fish 4 times a week to get that fatty fish. And then my surprise supplement is collagen, actually. So this is one that's kind of a big fad right now, but I really like collagen that is collagen peptides. So they are, you know, easily absorbable, dissolved in water. And when combined with an antioxidant like vitamin C and some of that stuff, it can really help. There's been some really good new research on that.
I'm easy, prenatal vitamins. So if you're thinking to at all, you know, think about pregnancy or egg freezing, we encourage a prenatal vitamin. And then my favorite for the energy of the egg, so that when sperm goes in it, we can make a good embryo, is CoQ10 or ubiquinol. And that also has cardioprotective when we're older women to take that helps our heart as well. But CoQ10 or ubiquinol, not even a huge dose, just a little bit, can improve the mitochondrial energy of the eggs. And so that can help reproduction.
Great. Well, thank you so much. I appreciate all of you being here. You're all phenomenal.